Good morning and welcome to the High River District Healthcare Foundation. I'm Jody Seeley and welcome to our monthly healthcare conversation. And today we have a few special guests joining us, which is so fun. We've got kind of a full house. So please welcome to our conversation today, Dr. Jennifer Norheim, Ria Liddle, registered nurse, and representing our youth as one of our youth volunteers at the hospital, Megan Deering is here. Ladies, thank you for being a part of the show today.
Yeah, you're welcome.
We're so excited. Can you tell? I think Ria froze on us, but hopefully she'll come back in and join. That's the fun of going live, is we just really never know what to expect. So when Ria reconnects, she'll come back in. She was saying in the clinic where she works, they play a lot of music in the hallways and it's quite loud. So she went out to her car because she thought it would be a little bit easier to hear us and stay connected. So we'll see how that goes. Oh, she's coming back. We'll just wait for her there for a second. So anyway, thank you for connecting with us. And our conversation focus this month has been a lot around teen and youth in the community. Now, our healthcare conversation series that's been going on this year has had a bit of a women's health focus. And so we were really excited to learn that Megan was volunteering at the hospital and of course represents exactly the target that we want to talk about today. And Megan, thank you for being a part of that and agreeing. And how long have you been volunteering at the hospital?
So I volunteer during the summers. So I started last summer around May. So kind of a year, kind of less than a year, kind of hard to tell, but yeah, kind of around a year.
Well, I feel like in the last couple of years, we've sort of lost true concept of time anyway. So
yeah, true.
Yeah, Groundhog
Day.
Day.
Yeah, exactly. What led you to volunteer at the hospital?
So I'm currently a university student and I'm in kind of the healthcare field, but I wasn't really sure like what I wanted to do, and I haven't really had much healthcare experience like in a hospital or anything like that. So I kind of reached out and it's been great so far. I'm learning a lot and I've done a few volunteer positions, whether that's the long-term care unit or kind of just helping out on the third floor, unit 300 as well. Yeah, and I really, really enjoy it. It's been great.
That's awesome. Well, one of the things we wanted to sort of find out is, I guess, topics that were top of mind that youth, teens, and kids are facing in the community when it comes around healthcare. And so we asked people working in that field sort of what are some of the topics that they see coming up that people are asking about. And we're going to talk about those today. But Megan, I don't mean to put you on the spot, but even if you think of growing up in your small community and now being sort of a young adult within that small community, what do you feel were some of the challenges or areas where you would have liked to have seen more support or saw great support in the focus of healthcare as a young person?
Well, it's a bit more prominent now more than ever, I think. But definitely like mental health has been there's been a serious rise in how many people are struggling with it. And even the resources that are available, whether it's like at a university or in the small community like High River, Okotoks, or things like that, I find that they're not as readily available as they should be. You don't really realize that until you start looking for them, you know? So I find that's been definitely a big struggle with COVID as well.
Yeah. So mental health, kind of the biggest piece.
Yes.
Dr. Norheim, Ria, would you say mental health has been one of the things that you have seen the most, both in your professions and working at the teen clinic?
You know, I think certainly the past 2 years have increased everybody's need for mental health support. It's been a tough 2 years for everybody. At our clinic, we do offer counseling sessions. Although our clinic is primarily drop-in based, the sessions require booked appointments because they're 90 minutes. They are designed to deal with anxiety, depression, or reduction of stressful circumstances. And it's myself or another female physician, a psychologist, and the client. And those are really quite accessible. We're not booking too far ahead right now, and those services can be booked either by popping into Teen Clinic any Tuesday between 2 and 6, or by phoning our main number, 403-652-1654.
That's awesome. Okay, we'll segue for a moment into talking about the teen clinic itself. And I don't know if there's a huge amount of awareness around this clinic. Maybe if you have teens, you're aware of it, but if you're somebody who's just got more littles or your teens are more grown up, you sort of lose learning of being, I guess, directly involved in that community. But we do have a teen clinic in High River. Can you tell us a little bit about it?
Well, sorry, Ria, I'll take this at first, and I'm sure you have things to add. I do want to stress it's not just teens, it's teens and young adults, because it's kind of a continuum. So we are open every Tuesday between 2 and 6 for walk-in services. We are located in the Calgary Rural PCN office, which is at 303 9th Avenue Southwest, or it's basically on the first floor of the Charles Clark Health Center, right next to the pharmacy. And we offer services around birth control. And to speak to a little more to that, we can provide birth control on site if people don't have coverage or are uncomfortable accessing those services publicly. We can do STI testing, pregnancy testing, emergency contraception, and we also provide education on birth control, STIs, healthy relationships, drug awareness, and pregnancy. And having said that, we kind of say our services are open to all teens and young adults up till the age of 27. But if somebody outside the upper age limit needed our services, we would not turn them away.
Right.
Okay, I'll just add a couple more things. Now my internet is actually working. Sorry about that.
That's okay.
So I was going to echo that we are officially the Youth and Young Adult Clinic just because we go right up to that age of 27. We're funded and operated by the Calgary Rural Primary Care Network. And we are, like Dr. Norheim said, we're a walk-in service. We run with Dr. Norheim as the doctor, myself as the registered nurse, and we have a wonderful admin named Connie. We aim to be open, welcoming, and inclusive as a service. We want anybody to be able to feel that they can attend and that we're a safe space for them. So yeah, that's kind of our premise as a service.
Were you aware of the clinic, Megan, when you were growing up in the community?
No, I actually wasn't. Even now, like up until a few weeks ago, I had no idea. Which I think that's like a very important resource to have, and like as a teen as well, that's really important. And I had no idea.
Yeah.
So like now we got to spread the word, right? To let people know that we have this incredible service. Okay, ladies, one of the things that we heard from some youth that were sort of pulled into questioning where they'd like to see more support is around the topic of mental health, is that we were told that sometimes there's family situations where maybe mental health is minimized at home or unsupported, and that youth or teen or young adult or whatever we want to call them isn't sure how to get that support. How do we as a community, how do we as, you as this clinic, how do we as like Megan and her friends, how do we support people going through that process where they're not getting that support in the home base?
So
Whoever
I want
wants
to
to
be
go
clear not to dismiss this as a concern. I want to be careful with the assumption that parents do not understand mental health issues. There can be many reasons why this may be the perception, but without knowing specifics, it's not really fair to assume that this is always the case. Bearing in mind that the job of teen and young adults is to develop an identity separate from their parents, there can be many complex dynamics in these relationships. So the best answer that I can give to this question is to say that at the Youth and Young Adult Clinic, we're certainly willing to allow parent involvement if the youth feels that can be helpful. So, I mean, typically the youth initiates the session and we deal with the youth, but if there's specific issues with the parent and the youth feels it could be helpful to involve them, we can involve them in any part of the session with the youth's permission. And again, the client or the youth has control over what information we share with the parent. So sometimes that can be helpful in sorting out these dynamics.
And just kind of
Absolutely. Well, and knowing they have that option. Yeah.
yeah.
Sorry, Megan, go ahead.
Okay. To kind of add on to that too, sometimes too, it's not necessarily that the parents are unsupportive of their child, kind of. Sometimes like a support is not being their resource, but kind of just helping them with what they need. So if the teen youth wants to go or like to the teen clinic and doesn't necessarily tell their parent, I think that's fully okay as well. Maybe they want to share that at a later time, being like, oh, I needed a little bit of assistance, some help, so I went to the clinic and now I'm ready to talk about it with you as well. And in some situations that's also support, and I think that kind of needs to be more broadcasted as well. Yeah.
I think that's a really excellent point. Our clinic operates on the premise that youth seeking care are treated as a mature minor, which basically means we presume that you're able to understand, the implications of the decisions you're making and are able to direct your care. And so because of that, we can see people without parental consent. In very rare cases, and I can think of maybe 2 or 3 in the last 13 years, we have concerns about the maturity of a youth to direct their care, in which case we do need to look for more parental involvement, but that's extremely rare.
I just wanted to make
anything you want to add to that, Ria?
Yeah, just more specifically around resources for youth with accessing mental health. So obviously we have the shared mental health platform that runs out of our clinic that Dr. Norheim leads on. And again, that's a mature minor approach. There is an assessment there for that, but that is the approach to that. We also have within the Calgary Rural PCN a youth navigator funded by our organization. And so the youth navigator can be accessed by us if a youth comes into the clinic and there are concerns going on, if there's homelessness, if there are needs to access an alternative mental health platform, things like that, then we have the ability to refer into our youth navigator, and she will hook up with the youth, talk about needs, and look at building services around people. And she just mentioned to me a few services that are also available. So we do have Foothills Community Counselling, which is a fully funded service out of the High River, again, the Charles Clark building, through the Great Foothills Family Resource Network. So that's another source of mental health counselling and support that's funded within the High River area. And then there's also quite a few programs through the Calgary Centre for Sexuality that are based online. So they're a very inclusive service, and they'll do one-to-one peer support kind of things like that. But they also do run workshops for parents. If parents are wanting to build on their understanding of different areas, they do run workshops out of that as well.
Which I think is great, because anytime we can have more tools in our toolbox, that's a win at the end of the day. And I think too, sometimes when our conversation, when it comes up to people thinking there's barriers to getting support or barriers to programs, lots of times I think that can come with just not knowing what's available to people in the community. So that's, again, one of the reasons we wanted to have these conversations. And so a barrier conversation came up too, in that some youth expressed that they had barriers to accessing resources or support, because in a lot of cases, and I'm going by what the information we were fed, I will admit my ignorance here, but they said that you need to have parental consent. So is there, I guess, scenarios, you kind of talked to this before, but is parental consent needed for all things? Does it really depend? Like, it's hard to generalize that, isn't it?
It is. And it's really hard to know the legal policies around services other than our own. So I think I've highlighted our premise. Most family doctors, again, could see teens without involving their parents if they determine they're a mature minor. A lot of services do require parental consent, but I would also like to stress that just because a parent consents for their minor to receive counseling services and the like, it doesn't mean that the parent is going to be privy to all of that information. So some services require parental consent to provide the service, but it doesn't mean that all that information can be released to the parent. It is service specific, and I can't really comment on services other than our own.
Yeah,
All
no, that makes sense.
services, though, if they feel that a minor is at imminent risk of harm, do then have to notify appropriate authority, whether that be the parent or other authorities.
Yeah. Youth homelessness. So Ria, you mentioned that a moment ago, that it's one of the things that you provide some support on that. And I feel like this is a conversation in even starting in the awareness that if you ask the majority of people in the community if they thought there was an issue with youth homelessness in High River and Okotoks, I think they would say they didn't think there was one. I think this is one of those scenarios that is happening in community and community doesn't realize. What have you guys experienced around this topic?
So for us, really, I mean, as nurses in clinics, we do occasionally come across things like that. This would more be part of the Calgary Rural PCN social work team's area. So in preparation, because our youth navigator wasn't able to attend today, she did send some information across, and she said actually there is an issue in the community with it, and she said it's not. It often will show itself as a lot of sofa surfers. So, you know, teens moving from friend to friend, staying on a couch, bouncing around a little bit. But then we have had a few cases recently with older teens where they are literally homeless, and she was saying that she's worked quite a lot with different organizations, exploring options, exploring family and relatives to be able to help out in those situations. But ultimately, service provision moves to Calgary if that isn't successful. So the only place that a person can be placed for homelessness right now is in downtown Calgary, which obviously that brings issues because you're removing a youth from their community, from their support systems, and having to place them somewhere a fair distance from that to be able to have a home to live in, you know, to be able to have somewhere to stay. So I really do think that that is a concern. Maybe we don't get the same magnitude of cases, but there are definitely cases going on. And currently, the process removes them from their community, so it isn't an ideal situation at all at the moment.
But I think the first step is us even having that conversation and bringing up the awareness of it in community for people to know this is happening. This is the only current solution. How can we start to bring our brains together to rectify that or make it better, or, you know, just start that brainstorming conversation process?
And our youth navigator is very, very open to reaching out to community organizations and things. So she would absolutely be, you know, be available and able to share experience and be part of that brainstorming. I would imagine. Can't speak for her, but she's very involved in the community and building relationships with people in the community, and, you know, trying to spread the awareness of these types of things so that action can start to build momentum.
Yeah, and I was kind of add on to that as well, just because
Please.
I feel like people kind of associate like homelessness with like just people on the street just living. And obviously in our Okotoks and High River, we don't see much of that. So I think people just assume that it's not happening, whereas it's not. Like homelessness is not just on the street, like it is kind of bouncing around, couch surfing, whatever that may be. So yeah, I think raising the awareness for that is really, really important.
Yeah, and I know that in our community, it calls it like there's people living in their cars that people have no idea. Like, I think that's the thing of bringing a conversation up is that, okay, this is an issue that happens in our community. It's not just an issue that happens in the city. And I think that's the mentality that sometimes we run across for sure. One of the other topics I wanted to bring up before we let you go and be conscious of people's time, because I'm sure we could talk, I'm sure all of you could talk all day long about the amazing work that you do in the community, but it's also Sexual Assault Awareness Month. And there's been conversation that comes up a lot around that. And I know healthy relationships is one of the things that you guys deal with in the clinic, and the topic of consent. And I think for parents, it's accessing resource of having better conversation with that. But I think too, it comes into the age group, the youth, our young people, our teens, understanding fully what consent means, how to control that in their own selves, how to have conversations with their friends about it. What do you guys think about more awareness on that?
Well, it's kind of hard just because at my university, actually, there was this huge thing about sexual assault and consent and things like that. So it kind of hit a little bit close to home just because it was happening on campus as well. So for that is, I think, since majority of cases for sexual assault as well happen with like people that you know or are friends with and things like that, I think potentially maybe people are afraid to hurt a relationship, so they kind of remain silent and don't speak up and say no, which obviously you should if you're not feeling it or not into it. Like, there's nothing wrong with saying no, and like, that's super important, and remaining silent is not a it's not a yes, and it's essentially a no, but I think people don't take it that way, which I think needs to be changed and needs to kind of raise awareness for that.
When it becomes comfort in having those conversations, right? Like
Yeah.
talking about that it's uncomfortable.
Mhm.
So the more we do it, the less uncomfortable it will be, but it's hard to jump into that. Dr.
Yeah.
Norheim?
So I would say there's no such thing as dumb questions. And if people, want to have a conversation around that kind of thing, absolutely drop into Teen Clinic. We can converse with you and answer your question. I think the key is clear communications between partners. That is absolutely the key. And when I say clear, I also mean when you're having those conversations, it's really best not to have the communication impaired by drugs or alcohol. It's just really important for both partners to clearly express what their expectations in this interaction are.
Yeah. Can I add?
Please.
Please.
So consent is something that is a real big thing at the moment. I met with quite a few high schools this year. As an organization, the Calgary Rural PCN decided that we wanted to try to fill gaps that were needed. And so we're currently working on program development for doing outreach into schools on specific subjects and areas. And consent was a resounding, we need this, we need more information on this, people need to know where they stand on this. And I'm currently working on the program development for that to be able to have that up and running for fall when the school starts again, to go into schools, to talk about it, to start opening communication up about it. There are some really great resources. There is a website called, let me just double check because I wrote it down so I didn't get it wrong. It's teachingsexualhealth.com, and that has a section specifically for parents as well as those that want to teach. It has loads of information, and it has sometimes maybe we fear those conversations as parents because we worry that perhaps we're not going to have all the answers and we don't know what to say, or and so I think being able to build our literacy around that area so that when those conversations come up, and it doesn't have to be huge, but it's just, in these situations, you have the ability to say no at any point. That in a relationship like this, you have a right to be treated like that. You know what I mean? And I think opening conversations like that up, and then there's an incredible website called Sex and You, just the letter U, that youth can access, anyone can access really, but that's a really great website for youth to be able to go on. It has consent, it has sexual assault information, it also has information on contraception, healthy relationships, things like that. So there are resources out there that can help us build our understanding of it, but ultimately we need to be opening up that communication about it, which is why as an organization we thought, hey, let's reach out to the schools and get in there and start having these conversations so that people understand, because it's not just the standard sexual interaction consent piece. There's the sexting piece now, sharing images, intimate images online through devices and things. There are a lot of rules and laws around that. There are rules and laws around what age you are, what you can consent to, and things like that. So I think just bringing awareness of those key points so that people know when they're in situations exactly what they're entitled to do, exactly how they're entitled to approach it and things. And I think it will just kind of hopefully empower people in their sexual health as well.
Yeah. Well, and I love that you're looking at the options of how you can outreach that a little bit more, because I think too, one of the challenges is that there is some folks in the world who have like, even if it feels scary, they're going to come and walk through the doors of the clinic and seek out some more information. But there's a lot of people who taking that step to even walk through the door would seem like a really, really big one. So how do we get access to the people who need this information the most and meet them where they're at? Because that's another big, I think, key factor in bringing them that education. But I also love the thought of, teens and youth being able to come into that clinic and just not necessarily role play, because I don't want to freak people out to not do it, but like bounce some of those scenarios off somebody, because it's hard to, in reading a website, have to really understand, like, okay, if I'm talking to someone who I really care about and they're a best friend and I feel like I trust them, but I'm really uncomfortable, I don't know how to express those. Like, what are the words I even use? I try to think back to when I was that age. It's just like, you don't remember. And Megan, you're closer to the age, so maybe but those are hard to navigate things when you're going
and
through that time of life.
What I was gonna say as well is that I love how you're kind of going out to high schools and you also have this clinic open, because like at such a young age too, some people think it's like, oh, consent, yeah, that's easy. Like, I know what that means. But like a lot of people like don't, and having those resources to be like, hey, this is actually what it is, and what happened or what has been happening is actually not okay at like a young age, like high school, junior high, like that's important to realize. And I think by like reaching out to those places, like the high schools and the schools, I think that's a really good chance for people to learn what it is, and like right from the get-go,
Yeah, and I feel like even being comfortable as a parent to bring up. So I have a 13-year-old son. And so we were driving yesterday and I was saying, oh, I have this interview tomorrow talking about the teen clinic. Did you know there was a teen clinic in our community? And he's like, no. And I said, well, one of the things we're going to talk about, buddy, is consent. And he's like, rolls his eyes at me. Yeah, Mom, I know what consent is. And I'm like, well, no, let's unpack it for a second and I'm trying to throw out a scenario. And he's like, we've had this conversation so many times. I understand. But I think too, as a parent, is we have to keep pushing through the eye rolls and pushing through the things. And even though it feels like it's terrifying on the inside, right? As a parent to think like, oh, do I need to teach my child about consent? But we do, like, we really do.
Yeah, like it seems so simple, yet it just keeps happening. So it still needs to be talked about. It's not like it's just going away. Just because people know what it is or think they know what it is, it's not going away. So yeah, unfortunately.
Anything else when it comes to healthcare for the young women in our community that any of you want to add sort of to let people know about here at the end of our conversation? You feel good? We covered all the things?
I just want them to know the inclusive space. And yeah.
Inclusive space. I think that's what you said, right, Ria? You kind of froze on us there.
I think she's still frozen.
I'm going to see. I feel like she's just agreeing with me.
Yeah.
But Again, so can you one more time, Dr. Norheim, just let people know where the clinic is located and how and when they can access it?
So it is located on the first floor of the Charles Clark building, that big building across from the hospital. You just walk in the front doors and it's the second door on your left. And it is a walk-in clinic, open on Tuesdays from 2 to 6, and you can just show up. Did you want me to highlight the services again?
Sure, might as well, just in case.
So we can provide birth control, STI testing, pregnancy testing, emergency contraception, or just education around birth
Wonderful.
control, STIs, healthy relationships, drug awareness, and pregnancy. And then as well, we do have the counseling sessions, which do need to be booked. And our phone number is 403-652-1654.
Perfect. All right. Ladies, thank you so much for taking time to have this conversation today, to start some awareness,
And just a
to
keynote
help.
is that
Oh, yeah.
just a key thing, sorry.
No,
It's
that's
just that
okay. Please.
I think I'm breaking up. I'm so sorry. So I'm delayed for sure. But I just wanted to mention that our contraception is compassionate. So we provide fund that's a barrier.
So I can speak to what Ria is trying to say. We provide contraception for free.
Okay.
And it doesn't, I mean, if you have coverage and you want to use it, that's fine. But if you have coverage, but you're too uncomfortable to go to a pharmacy and get it and stuff, that's fine. We will give it to you.
You guys are here to remove barriers is basically what it comes down to at the end of the day, which is really great. So appreciate so much the information and your time talking about it. And Megan, thank you for sharing some perspective with us also. And I think, again, the more people that we can educate, I think as community, that's our job, right? Is to share that knowledge and to bring community together. And so just letting people know that this kind of service and these options are available. Because I think sometimes, especially becomes that stigma of small town, that there isn't access to resources and clinics. And like, you just think, oh, well, it's a small community. There isn't that, but there's more here than we know most of the time. And so it's just continuing to share that. So ladies, thank you so much for your time today.
Yeah, thank you for having me on here.
Yes, thank you for having us.
All right. If you'd like to access more of our healthcare conversations, you can find them all on our Facebook page or on YouTube. You can learn more about how you can support programs like this through the Health Foundation at highriverhealthfoundation.ca. Thanks, everybody.